Valley mom Courtney struggled after having her second child. Her nurse's training taught her there could be some hurdles after delivery, physically and mentally. But when she wasn't feeling right emotionally, she went to the ER to get checked out. But that visit turned into a 3-day mental health hold.
When you come into motherhood, which is a vastly different experience for every mom, the most common thing that many of us undergo is that feeling of overload, especially for the first time.
Jeanette Cole specializes in maternity wellness. She said what Courtney was feeling is very common.
And you don't really know what to expect until you're in the thick of it. What I do is I firmly believe in honoring the sacred part of that fourth trimester and protecting the mother baby dyad as much as possible.
Courtney is doing fine now, but looking back on those 3 days when she was at the hospital, she thinks maybe there could have been a more targeted approach and more awareness about postpartum issues. And despite best efforts by hospitals and clinicians, there is a gap in postpartum care.
You know, right now in Ohio, there's a huge, huge gap for mental health for moms, specifically moms of color. The way that we need to kind of bridge this gap is make more education available for everyone and continue ongoing care so that it doesn't just stop after your 6-week visit.
More programs are coming to help new moms. A new service in Trumbull County offers free in-home nurse visits after delivery. And in Pennsylvania, $5 million has been committed to provide comprehensive postpartum screenings and more work with doulas.
More than half of pregnancy-related deaths occur in between 1 week and 1 year postpartum, and mental health is the leading underlying cause of these tragic, preventable losses. Addressing this crisis and helping mothers get the care they need requires a comprehensive approach.
The goal is to remove the stigma and get help. Stephen Diachille lost his wife Alexis to postpartum depression just 6 weeks after their daughter was born.
It's hard to say I'm having thoughts of harming myself, especially after just delivering a child. We went to 7 different facilities, crisis centers, healthcare facilities in our last 13 days, desperately pleading and begging for help.
A foundation in Alexis's name has been established to raise awareness and really drive action that will support moms after they leave the hospital.
There's a big stigma that it's shameful for moms to get help because we're supposed to be able to do it all. We just need to have everything more accessible because then again, like what happens after 6 weeks? You filled out, you've done your checklist, hospital's good to go, your provider checked you off, you're good to go. But then what happens after that time?
Hi everyone, I'm Lindsay Watson. Thanks for watching the WKBN 27 First News YouTube channel. If you want more video news, subscribe to our channel. And don't forget to download the WKBN 27 First News app for breaking news alerts.